Chapter 9, Venipuncture. In this chapter, we will learn the steps necessary to perform a competent, effective venipuncture and describe special procedures, signs and symptoms of venipuncture complications. So these are some key words sharing with you throughout the lecture. You will find those words many times. The first topic is to know the word venipuncture. Phlebotomists use a variety of techniques to acquire blood specimen. The most common one is venipuncture. Routine venipuncture procedure consists of a series of detailed steps that must be performed safely and accurately. Adjustment to procedures may be required for patients whose blood is difficult to collect. Okay. These are the steps, starting with greet and properly identify patient, use aseptic techniques, select and assemble appropriate equipments, provide proper post-puncture patient care, adhere to the specimen labeling requirements, and correctly handling transporting specimen. These are the equipments you see in this slide, which is gloves, tourniquet, alcohol prep pads, gauze pads, needle, evacuated tube holder or syringe, evacuated tubes, sharps container, adhesive bandage, permanent marker, pen, or computer labels. Make sure that the tube adapter and the needle are compatible. Items made by different manufacturers may not fit together properly. Line up the equipments near the patient with the tubes assembled. Attach needles into the adapter. You can screw the needle all the way into the adapter, push the tube into the tube adapter, but only up to the adapter guideline. Do not push the tube all the way into the needle because this will cause a loss of vacuum in the tube. And do not remove needle cap yet. Proper patient positioning. Patient should be lie supine, that means face upwards, or sit in a phlebotomy chair like this. Straight chair with arm, use pillow or towel if necessary. Now, the tourniquet application, these are the steps that is explained here. And you see how to position the tourniquet. Cross the left one over right, then tuck the left end under right end. Loose ends point towards shoulder. Okay. So regarding this tourniquet part, I want to share a short video for a minute or so, and you will see how it is actually done. So let's watch this video how to apply tourniquet and find this video. Find the
Okay, today we're going to learn how to do a tourniquet application, and we're also going to learn how to palpate for the veins that we will be accessing for phlebotomy. What you'll need for this is you're going to need a tourniquet. You can use a new tourniquet, or you can also use a tourniquet that's been previously used as long as you've wiped off and cleaned it before using. We never reuse a tourniquet once blood or other soil contamination is on the tourniquet. First thing we want to do is obviously you want to wash your hands or sanitize your hands. When I pretend a little bit with the hand sanitizer, you'll put a little bit in your palm, rub until it's completely dry. Now take just about 15 or 20 seconds. If you wash your hands, you need to hum happy birthday twice to yourself to make sure you've washed your hands enough. Once you've done that, you'll greet your patient, tell them who you are. Hi, I'm Trevor. I'm from the lab today. The doctor's ordered some samples from you. Do you mind if I go ahead and take a look and see if we can get these samples? Patient gives consent. So let's go ahead and begin our procedure. We have our non-latex tourniquet. Make sure it's good and good and intact, no rips or tears or no signs of soil on it. Going to place it around the patient's arm. You want to keep it flat in the back. Raise your arm. If you notice in the back, it's still smooth and flush in the back. We try not to let the tourniquet roll, as that will cause our patient a little bit extra pain. Okay. All right. So I have my tourniquet around the patient's arm. With my non-dominant hand, I'm going to position the strap on the back side, give it a pull, place my pointer finger of my non-dominant hand underneath the tourniquet, pull with my dominant hand, and we're going to tuck under, leaving a little tab to release the tourniquet. Remember, we always want frog legs up, bunny ears up, not frog legs down. So we have our tourniquet in place. It's nice and smooth and flush. We just need a little bit of constriction to get the veins to pop up. So you can ask your patient to make a fist. You don't ask them to pump their fist, just make a fist, and this will help in assisting finding the veins. With the two index fingers of your non-dominant hand, what you'll want to do is you'll want to start from one side of your patient's arm and palpate, pushing in and down, moving gently across. Your first sweep, you're just seeing what's on your patient has, and then you'll pass through again, determining if you have a vein, artery, or tendon, and choose your selection site. And with this patient right here, I'm going to go right here with this vein. All right. Then you'll release your tourniquet and prepare your slides. And this is tourniquet application and palpitation.
Okay, so that was a good video. Let's go back to our lecture. Uh, Today we are covering this lecture, chapter 9, which is venipuncture. So far, we know the equipments. We also know how to use the tourniquet and find veins. Okay. So we should position the arm at downward angle. Ask patient to make a fist. Examine the antecubital area. That area pointing in this picture, this is the called ACS space or antecubital space. Palpate vein with the fingertips. Veins are usually bouncy and do not have a pulse. If we feel like something is pulsating, that is likely to be an artery. If we feel like tough, stringy things, that is the tendon. Site that is swollen or has lesions, we should avoid that. Site which is the place for IV or on the side of a mastectomy site are not to be chosen for this venipuncture. The 1, 2, 3, 2, 1 method. What does that mean? This is the method to ensure that you have all of the equipments you need and one pair of gloves, two tourniquet, and two means tourniquet and alcohol swab. Three means needle holder, tubes, those three things. And again, two for gauze and bandage, and then one sharp container. So 1, 2, 3, 2, 1. That is what you can apply when you are gathering your supplies. Children may become even more anxious about a phlebotomy procedure than adults. Allow the child to view the needle for as short a time as possible to help reduce anxiety. Squat down to child's height to reduce intimidation. Never lie. If the child asks whether if it is painful, say yes, it will be a little bit painful. Um, Ask the child's caregiver to help. Use restraining chair or arm boards if necessary. Have special bandages or stickers available as rewards. And always be honest and direct. What about geriatric patients? Elderly patients or geriatric patients often have physical challenges not present in younger patients. including arthritis and diseases that cause tremors. The needle may need to be held at a shallower angle. Normal angle is 15 to 30 degree, but this time it will be less than that. Uh, Allow extra time for communication if sensory impairment exists, like loss of hearing or vision problem. Their skin is fragile and veins tend to roll, so hold the skin taut. If you're using a butterfly needle, the shallower angle should be applied while you are inserting the needle. Aseptic techniques. We can use 70% alcohol pad uh, to do this. The concentric circle, that is the point to note. Look at this. We start at the middle and then spiraling outside. Okay, it's a concentric method so that you don't go back to the place where you started. Rubbing an antiseptic back and forth over a puncture site may bring bacteria from areas distal to the site and deposit them on the site of blood collection. Drawing concentric circles with the antiseptics from the center point outward pushes the microorganism farther and farther away from the puncture site. So this cleansing site prevents contamination of both the specimen and patient's venipuncture site. We should apply sufficient pressure to remove surface dirt. If the site is especially dirty, repeat the procedure with a new alcohol pad. Allow the alcohol to dry completely before continuing with venipuncture. If the alcohol has not completely evaporated when performing the venipuncture, the alcohol may mix with the specimen and causing hemolyzation and affecting the test result. Do not blow on or fan the site to hasten the alcohol drying process. There will be another video to show how this total venipuncture is done. But before I share that, few other things to consider. Before you insert the needle, reapply the tourniquet. Visually confirm the site, anchor vein with the non-dominant hand, and insert the needle. Look at that angle, 15 to 30-degree angle. We'll have to remember this number. Many times there's a question in your exam about this angle of needle. What are the causes of unsuccessful vein punctures? If the blood is not coming, never probe for a vein or move the needle from side to side once it is in the arm. Doing so may cause pain, injury, and lawsuit. Poor site selection. If the area is very hard and sclerosed, or patient fails to remain still, tourniquet too tight, use up expired evacuated tube, uh, and use up tube that has lost vacuum. These are some reasons for unsuccessful venipuncture. In this picture, you can see some situations of unsuccessful venipuncture. Number A, in the left upper corner, you see the bevel on the lower wall of the vein. Okay, so it is touching the lower wall, the bevel one. This bevel should be always facing up. If not, this is what can happen. There will be no blood. In B, in that case, the needle is rotated, allow the blood to flow. That we can do. This helps. In the picture C, needle inserted too far. It goes through and through. So that is another reason. And the last one, needle is partially inserted, causing blood to leak into the tissue, which is called hematoma formation. So what to do if the initial venipuncture is not successful? First, we'll replace the tube if you suspect a defective tube or vacuum. Second, pull back slightly on the needle if the bevel is against the wall of the vein or if the needle has been inserted too far. This will correct the position and allow blood to flow. Stop pulling back when blood begins to flow. Advance the needle a little farther into the vein in case the needle has not fully penetrated into the vein. And do this only if the vein is not yet punctured and a hematoma is not forming. Try releasing the tourniquet slightly to improve blood flow. Remember, never probe the site with a needle. Each facility has its own policy regarding the number of times a phlebotomist may attempt. Generally, the maximum number of attempts is 2. If you are unsuccessful after 2 tries, ask for assistance. Now, insert the vein, insert the first evacuated tube to start blood draw. Hold equipment steady during the tube changes. Allow each tube to fill completely and then mix tubes with additives immediately. 5 to 8 times, slowly we have to mix those things in the tube. Remove the tourniquet, release this thing, place gauze on puncture site and then remove needle smoothly. Remember the sequence: tourniquet, gauze, needle. After the needle is out, engage needle safety mechanism. Apply gentle pressure to patient's arm. That helps to stop bleeding. Now, I need to share another video. This time you will see how the blood drawn is done. So let's watch this and we'll come back for the rest of the lecture.
Today we're going to be performing phlebotomy with a straight needle on a live patient. The most important part of any procedure is making sure that you have the appropriate equipment before you begin. So today we have gathered our equipment and set it out. We will use non-sterile gloves. We will use a tourniquet to apply to the patient's arm in order to engorge the vein. We will use a 2x2 piece of gauze. We'll use an alcohol swab to cleanse the area. We will be drawing a CBC, which in this case is a lavender vacutainer. We'll be using a plastic hub to attach to our venipuncture needle. So we also are going to be using Coban today instead of a Band-Aid because our patient has sensitive skin and Band-Aids sometimes irritate people's skin. So Coban is another option. So I'm going to wash my hands as I would before any procedure. Then I'm going to don my gloves. I'm actually going to connect the needle to the hub before we begin. You can see this attaches right here. It screws in. And be careful because this is rubber on the outside, but underneath is a sharp needle that actually pokes right into the vacutainer and breaks the seal on this. So be careful because if you push hard enough on this, you can hurt yourself, stick yourself. So we're going to attach that, and then our needle is underneath here, so when we're ready to perform the procedure, we'll just remove this. I usually like to kind of put the vacutainer gently inside here for now. Just got everything ready. And I'm going to open up my alcohol swab here, set that aside. And now I think we're ready for our patient. So we will have our patient place the arm on the sterile area here, and we'll explain the procedure to the patient. Today we're going to be performing phlebotomy. Have you ever had phlebotomy before?
Yes.
Okay, do you know of any good veins?
Yes.
Where are they? Are they in your antecubital area here?
Yes.
Okay, so I'm going to apply my tourniquet, and I want to make sure that I can get it off quickly. So what I'm going to do, instead of tying a knot, I'm going to cross it and just tuck a little corner underneath so that when I'm done, I can pull this off very quickly. Okay, so now I'm going to have my patient make a fist with his hand so I can kind of see which veins are going to be good. It's very important to palpate. All right, I think we're going to try this one right here. Okay, I'm going to cleanse the area. You can see I'm cleansing in a circular fashion. We'll let that dry. Sometimes the alcohol can sting a little bit if you poke the patient while it's still wet. Okay, going to remove my cap from the needle. I'm going to pull traction and we're going to begin the procedure. So you're going to feel a poke, okay?
Mm-hmm.
Okay, with straight needle, you don't get a flashback, so you just have to assume that you're in. And we are. So you can see the blood automatically begins filling this. We want to fill about 3/4 of a tube to the entire tube. If we had additional vacutainer tubes, we could pop them on. However, we do not. So I'm going to remove the tourniquet now. I'm going to pop my vacutainer off, invert the tube, and pull the needle out while applying pressure to stop the bleeding. This is a retraction needle, so what we can do is clamp this. So now we'll place this in the sharps. And I'm going to get my Coban ready, so I'm going to ask the patient to gently hold pressure for just a second. Okay, got a pre-cut piece here, so you can let go. Thank you very much. And I'm going to wrap this around. So Coban, if you've never used it before, it's kind of like an ace wrap, but it's a little bit sticky. So it sticks to itself without having to use any additional metal pieces or anything like that. All right. So once you're done with the procedure, again, you want to invert your tube, label the blood, send it to the laboratory, and always clean up your area. We'll thank the patient.
Okay, so that was how the venipuncture was completed. Let's continue with the lecture, which is chapter 9. Now, the difficult blood draw. Right? We use a butterfly set when standard draw is not possible. Standard one is the multi-sample needle. This is the butterfly set. Do not use with evacuated tube if the patient has fragile veins. For children, patients who have a very small or difficult to access veins, and patients who have conditions in which they are not able to control tremors or shaking, you'll need to adapt the procedure to patient's situation, like this one. Although a butterfly set can be adapted for this, if the patient has a smaller fragile veins, the evacuation system may cause the vein to collapse. Therefore, a syringe is preferred so that the phlebotomist can control the amount of pressure applied to the vein. The steps of performing venipuncture using a butterfly set are the same as those for routine venipuncture, but you will need to perform a few extra steps before you begin. Assemble the correct evacuated tube for the test to be performed. After you draw the blood into a syringe, you will need to transfer it to those tubes for processing and remove the syringe from sterile packaging. Push the plunger in and out to ensure free and smooth movement. Let's take a look into these pictures. You see the transferring devices. The left one, the first picture, the peel off the backing from transfer device, and then insert the syringe tip into the hub and rotate syringe clockwise. Hold the syringe facing down and push the evacuated tube into the holder. Do not depress the plunger of the syringe. After removing the evacuated tube, discard the tube holder and syringe in an approved sharps container. Next is the complication. Patient may be allergic to latex or alcohol. So you should only use non-latex tourniquets and adhesive bandages. If the patient is allergic to alcohol, use an alternate antiseptics. If the patient is allergic to many types of antiseptics, use warm water on a gauze pad to clean the puncture site. Syncope. Syncope or fainting may occur during phlebotomy. If the patient faints, remove the tourniquet and needle to prevent patient injury. Do not attempt to handle the situation alone. Call for help. Apply pressure to venipuncture site. Position yourself in front of the phlebotomy chair or next to the bedside to block the patient from falling or sliding out of the chair or bed. If the patient is sitting, then lower the patient's head and arms between his or her knees. Petechiae are some bleeding points, small non-raised red spots on the skin, usually due to an overly tight tourniquet or tourniquet being left on too long. Make sure the tourniquet is not too tight and apply tourniquet for only 1 minute at a time. Arm movement may cause bleeding to occur. Check the arm before leaving the patient. Apply adhesive bandage over a clean piece of gauze. Hematoma. Hematoma is a mass of blood caused by leakage of blood into the tissues. And this may occur if the needle has gone through the vein, the bevel of the needle is not fully inserted into the vein. Uh, you forgot to release the tourniquet prior to removing the needle. All right. So this is what to do if the hematoma occurs. First, release the tourniquet, pull the needle out, apply firm pressure at the site. If patient complains of discomfort, apply ice. Iatrogenic anemia. Anemia, anemic response to removal of large amount of blood over short time period. More than 10% of blood loss may become life-threatening. Iatrogenic anemia. And another term is exsanguination, which is also life-threatening. It occurs easily in small children, patients, or infants. If the large amount of blood is lost, that can cause this condition, exsanguination. Puncture site infections are not common, but they do occur. In that case, to avoid, we will follow the guidelines. Do not remove the cap from the needle until you're ready to insert the needle into the vein. Never remove a needle cap or lancet cover and then set the needle or device on the bed or other surface. Ask the patient to keep the bandage on the puncture site until bleeding has completely stopped. Microorganisms may be present in the scar tissue and can be introduced deeper into the puncture site by the needle. To avoid the puncture site infection, ensure sterility. Do not touch the site after it is cleansed. Apply pressure and never puncture through a previously punctured site. Never insert the needle too deep and never probe a vein. If a vein feels very tight and stringy, it may not be a vein, tendon, so avoid that. Nerves lie close to blood vessels and may be punctured if you insert the needle too deep. That can be the reason for nerve damage. Additive reflux and choking. The flowing of blood mixed with tube additives back into the vein, that's called additive reflux. It may cause adverse reactions, and to avoid that, always collect blood with patient's arm and evacuated tube in a downward position. Choking during the procedure, patients should not chew gum, eat or drink anything. Situations that affect specimen quality are these. If by accident we are drawing blood from artery, that may be great enough to push the tube out of the tube holder. After removing the needle, apply firm pressure for at least 5 minutes or longer if bleeding continues. Instruct the patient to keep the arm still to minimize the flow of blood. Notify a nurse or other licensed professional to assist with prevention of hematoma formation. In most cases, arterial blood cannot be used for testing. If it can be, the normal value will be different than from venous blood. So the specimen must be clearly labeled as arterial. Hemoconcentration. That means the blood is concentrated. Rapid increase in the ratio of blood components to plasma, that is called hemoconcentration. Water leaves the vein and enters the tissue. Water that remains in the vein contains falsely higher level of cells and chemicals. It can cause erroneous results in some lab tests, like protein levels, cell counts, and coagulation tests. So before we finish this lecture, I just want to share one last video. This one is actually the best video. So just 1 minute, we are going to watch this and finish this lecture, and that will be the thing to be done. Okay. All right, so let's watch it.
Hi, Elena.
Hi.
Hi, my name is Steven. I use he, him pronouns, and I'm here to draw your blood.
Great.
How are you doing today?
Oh, not too bad.
Fantastic. Well, before we go further, I'd like to verify that I have the right order. Could you please verify your full name and date of birth, please?
Yeah, Elena Satter, 7/30/88.
Fantastic. That's what I have here. I'm going to give your table a little wipe down here.
Okay.
So how do you generally do with blood draws, Elena?
Not too bad.
Okay, great. Do you have an arm preference?
Usually I think this one.
Okay, fantastic. All right. First step is I'd like to put on a tourniquet.
Okay.
Fantastic. Does that feel okay?
Yeah.
Okay. All right, would you mind rotating your palm down for me? Thank you. All right, and palm back up. That's perfect. Would it be okay if we went right here?
Sure.
Okay, we'll release your tourniquet. And I'm going to wash the site. This might feel a little cold. All right, does that feel dry?
It does.
Okay. Retie the tourniquet.
Okay.
Perfect. Does that feel okay?
Yeah.
Okay. Doing okay?
Yeah.
Can you go ahead and hold pressure for me?
Yeah.
Thank you. Okay. May I take another look at the site? Looks great. Would you mind holding that down for a second? Thank you. Are you okay with tape?
Yeah.
Okay. All right. Thank you very much, Elena. You were great. Have a wonderful day, and we'll get a hold of you as soon as we get those test results in, okay?
Great. Thank you.
Have a wonderful day. And that's it.
Okay, so that brings us to end of this first lecture, chapter 9.